What if I told you millions of people are silently living with a serious health condition, and they don't even know it? Just like in many countries across the Americas, countless adults go about their daily routines unaware that they might have chronic kidney disease, CKD. CKD comes with various physical symptoms, but many people tend to brush them off or simply don't recognize the signs. Most individuals only begin to notice the symptoms when their kidney function has already begun to deteriorate, often at advanced stages, or when they detect unusually high levels of protein in their urine. That's why only about 10% of people with the condition know they have it. While diagnosing CKD requires medical tests, there are 10 critical signs that could indicate kidney disease. If you have a family history of kidney problems, diabetes, or are over the age of 60, it's essential to undergo regular, annual checkups for CKD. Be sure to inform your doctor about any symptoms or discomfort you're experiencing, and bring along notes about your health before your visit. Now let's go over some key signs. Feeling more fatigued, low on energy, or having difficulty concentrating. This could be a sign of declining kidney function, as it leads to the buildup of harmful toxins in your blood, causing weakness, tiredness, and trouble focusing. You might also experience these symptoms due to anemia, which is often associated with CKD. Trouble sleeping? Your kidneys may not be filtering your blood as they should, which can lead to issues like insomnia. Sleep apnea is also more prevalent among CKD patients than in the general population. If you have dry, itchy skin, it may be because your kidneys aren't balancing minerals and nutrients properly. This can be linked to bone and mineral disorders, another sign of CKD. Do you find yourself urinating more frequently, especially at night? This could indicate kidney damage. In some cases, it might even point to a urinary tract infection or, in men, an enlarged prostate. If your urine appears foamy, particularly if it takes multiple flushes to clear, it could mean there's too much protein present, usually a type called albumin, which is similar to the protein found in egg whites. Persistent swelling around the eyes. This could signal your kidneys are leaking protein into your urine, which is an early sign of kidney damage. Swelling in the ankles and feet could be caused by sodium retention due to poor kidney function, though it could also indicate heart or liver disease. Loss of appetite is a general symptom but can be linked to the buildup of toxins from declining kidney function. Experiencing muscle cramps? This could result from an imbalance of electrolytes, such as low calcium or poorly regulated phosphorus, both related to kidney dysfunction. But what about kidney pain? Could it be caused by an infection, stones, or even cancer? Let's break it down. A kidney infection occurs when bacteria travel to your kidneys, often due to an untreated urinary tract infection. Common symptoms include nausea, dull pain, burning during urination, foul-smelling urine, back pain, and fever. Kidney stones develop when minerals accumulate and harden in your kidneys. Small stones usually pass unnoticed, but larger ones can cause severe discomfort as they move through the urinary tract, leading to symptoms like blood in the urine, nausea, and intense abdominal pain. Kidney cysts are fluid-filled sacs that often cause no symptoms, but can become painful if they grow too large or get infected. Polycystic kidney disease, PKD, is a genetic disorder that leads to numerous cysts, altering the kidney's shape and causing problems like kidney failure, high blood pressure, and kidney stones. And finally, kidney cancer may go unnoticed in its early stages, but can cause intermittent pain as it progresses. Engaging in contact sports such as soccer, horseback riding, or basketball can also put you at risk for kidney trauma, leading to discomfort or pain in the abdomen. In this video, we've broken down the key symptoms of kidney disease so you can stay informed. For a healthier life, make sure to like, share, and subscribe to help others benefit from this information. Stay healthy and see you in the next video.